Alright team, let's get into it. Today we're tackling a big topic for your NCLEX exam, antibiotics. Think of these drugs as your special forces against bacterial invaders. Antimicrobials are powerful medicines. They either kill harmful germs outright or stop them from multiplying. As a nurse, you administer these meds and watch over your patients. We'll break this massive subject into clear, manageable chunks. No jargon, no confusion. You'll learn core principles, major classes, and critical safety checks. For each group, how they work, what they treat, and key side effects. We'll highlight danger signs and the nursing actions you must take. Take a deep breath. We'll move at a good pace and won't leave anyone behind. First up, penicillins like amoxicillin and ampicillin, they attack the bacterial cell wall, weakening it until the bacteria burst and die. Effective for strep throat, ear infections, some pneumonia, and skin infections. Common side effects: upset stomach, nausea, diarrhea. Skin rash can appear. Big danger: anaphylaxis, wheeze, trouble breathing, swelling, sudden low BP. Always ask about penicillin allergy before the first dose. If severe, hold and clarify. Cephalosporins like cefazolin and ceftriaxone are penicillin cousins. They also destroy the cell wall. There's a small chance of cross-reactivity with penicillin allergy. History is vital. Uses include skin problems, UTIs, and surgical prophylaxis. Monitor for diarrhea. Consider C. difficile if persistent. Avoid alcohol with certain cephalosporins to prevent disulfiram-like reactions. Always complete the full course to prevent resistance. Aminoglycosides like gentamicin and tobramycin are potent weapons. They block protein production at the bacterial ribosome, lethal to bacteria, reserved for severe gram-negative infections, sepsis and complex hospital-acquired infections. Memorize the dangers: ototoxicity and nephrotoxicity. Monitor for tinnitus, dizziness, track BN, creatinine, and urine output. Use peak and trough levels to ensure efficacy without toxicity. Carbapenems, imipenem, meropenem are broad-spectrum power tools, attacking the cell wall. Reserved for severe, complex, or multi-drug-resistant infections. Main concern: lowered seizure threshold, especially with seizure history or renal impairment. Perform neurochecks and adjust doses in renal impairment. Administer safely, monitor vitals and labs, ensure the dose is right for the patient. Macrolides via azithromycin, erythromycin block bacterial protein synthesis. Uses: pneumonia, some STIs, and for penicillin allergic patients. Common GI upset, serious risk, QT prolongation that can lead to torsides. Be cautious in heart disease and with other QT prolonging meds. Tetracyclines, doxycycline treat Lyme disease, RMSF, and acne. Do not take with calcium, iron, magnesium, milk, or antacids. Avoid in pregnancy and in children under 8, risk of permanent tooth discoloration. Teach photosensitivity precautions. Protective clothing, sunscreen, avoid prolonged sun. Take with a full glass of water to prevent esophageal irritation. Fluoroquinolones, ciprofloxacin, levofloxacin target DNA gyrase, halting bacterial replication. They treat complicated UTIs, some pneumonia, and GI infections. Black box warning: tendonitis and tendon rupture, commonly the Achilles tendon. Higher risk in older adults, those on corticosteroids, and transplant patients. Teach to report tendon pain, swelling, or inflammation immediately. If symptoms occur, stop the drug and avoid exercise until evaluated. Monitor CNS effects, especially in the elderly. Confusion, dizziness, restlessness, hallucinations. They can prolong QT. Use caution with cardiac risk factors. Ciprofloxacin absorption decreases with antacids, iron, and zinc. Separate by at least 2 hours. Summary: see a fluoroquinolone. Flash a warning light for tendon injury. Always assess for interactions, especially corticosteroids, and monitor mental status in older adults. Sulfonamides, most commonly SMX-TMP, Bactrim septera, block bacterial folic acid synthesis for DNA, RNA. Humans get folate from diet, so the target is selective. Effective for UTIs, some skin infections, and MRSA. Check for sulfa allergy. Reactions range from rash to life-threatening Stevens-Johnson syndrome. Any rash while on a sulfa drug is serious. Stop and report immediately. Photosensitivity is common. Teach sun protection. Females of childbearing age on chronic therapy, 6 weeks, e.g. acne, should supplement folic acid 1 mg PO daily. Generally avoid in first and last trimesters and in newborns. Rare blood dyscrasias can occur. Consider periodic CBC on long-term therapy. Encourage hydration to prevent crystalluria, kidney stones, and kidney damage. Remember, check sulfa allergy, teach sun safety, and know the folic acid connection. Vancomycin, a glycopeptide for serious gram-positive infections, especially MRSA. It inhibits cell wall formation differently than penicillins. Oral vancomycin treats severe C. diff by acting in the gut. MRSA treatment is IV. Most famous adverse effect: Redman syndrome, flushing of face, neck, upper torso, dizziness, low BP. It is not a true allergy, it's a rate-dependent infusion reaction. Prevent by infusing slowly, typically 60 to 90 minutes. If symptoms develop, stop infusion, notify provider, give antihistamines, then restart at a slower rate. Monitor for nephrotoxicity and ototoxicity. Track creatinine and urine output, assess hearing, tinnitus. Risk increases with nephrotoxins like aminoglycosides or NSAIDs. Check trough just before the next dose to stay in the therapeutic window. Your responsibilities: infuse slowly, monitor kidney function and hearing, and check trough levels. Nitrofurantoin is for prevention and treatment of uncomplicated lower UTIs. It concentrates in urine. Not effective for kidney infections or systemic infections. It can turn urine brown. Harmless. Take with food or milk to reduce GI upset. Rare but serious pulmonary reactions can occur. Acute fever, cough, SOB. With long-term use, progressive SOB and lung damage. Teach to report numbness or tingling in hands and feet. Peripheral neuropathy. Metronidazole treats anaerobes and some protozoa. Used for C. diff, bacterial vaginosis, and trichomoniasis. It disrupts microbial DNA. Common effects: metallic taste and nausea. Prolonged use can cause neuropathy. Critical rule: absolutely no alcohol during treatment and for 48 to 72 hours after the last dose. Alcohol with metronidazole can cause severe nausea, vomiting, flushing, headache, and tachycardia. Avoid hidden alcohol in mouthwashes or cough syrups. Metronidazole can increase warfarin effects. Monitor INR closely. Universal priorities. First, allergy check. Ask not just if, but what happened. Think culture before you cover. Collect cultures before antibiotics. Give doses on time and teach patients to finish the full course. Monitor BUN, creatinine, liver tests, and watch for side effects or serious reactions. Penicillins, allergy and anaphylaxis. Cephalosporins, allergy and anaphylaxis. Vancomycin, Redman syndrome from rapid infusion. Vancomycin, monitor trough levels and kidney function. Fluoroquinolones like ciprofloxacin. Tendon rupture risk. Aminoglycosides, nephrotoxicity and ototoxicity. Monitor labs and hearing. Tetracyclines, avoid in pregnancy and in kids under 8. Teach sun safety. Sulfonamides, watch for sulfa allergy, risk of Stevens-Johnson syndrome. Photosensitivity, and for females of childbearing age on 6 weeks therapy, supplement folic acid, 1 ml PO daily. Metronidazole, absolute rule, no alcohol due to disulfiram-like reaction. Summarize your priorities in 3 words: assess, monitor, educate. Safe antibiotic administration is a hallmark of competence, and the NCLEX will test it. You now have a solid framework for antimicrobial pharmacology, mechanisms, uses, side effects, and nursing actions. These life-saving drugs demand respect. Administer with confidence, vigilance, and clear patient education. Keep revisiting the high-yield links: penicillins, cephalosporins, allergy, Vanco-Redman troughs, ciprotendon, tetra photosensitivity, pregnancy, sulfa allergy, folate, metrono alcohol. The NCLEX is designed to verify you can protect patients with this knowledge under pressure. You've got this. For more detailed info, review clinical texts and trusted sites. Visit www.brispainternational.com for further resources. Assess, monitor, educate. Safe care starts with you.